to get out of today is the procedure for doing catheterizations, right? I'm going to demonstrate the female catheterization online on Module 7. You'll see that there's a YouTube video for catheterizing a guy. Imagine this, but it's much easier to catheterize a man. So that's why I wanted you guys to see a little bit more challenging on the female, okay? So the first thing we're going to do when we come into the room, we're going to introduce ourselves, identify our patient. If they're an inpatient, we can check this as well, their name tag over here. But once we've done that, then we need to ask them if they were told that they were going to be catheterized, right? Make sure they understand what that is, okay? It's simply just inserting a tube into the bladder and draining the bladder. Now, there's a couple different kinds of catheters, okay? So I want to make sure we are understanding the different kinds of catheters. The two main kinds of catheters, the first one is a straight catheter. Straight catheter simply means we are going to put it in, we are going to drain the bladder, and we're going to remove it. So it's not staying, okay? It's just in there. It could be for a couple purposes. Perhaps somebody's having difficulty draining their bladder. It could be that, that they've just had like some type of bladder surgery. So for whatever reason, they're needing help draining their bladder, or it can also be that we need a sterile specimen. So sterile meaning it's coming directly from the bladder. So it's not that they have urinated into a cup, because we can never get that sterile. We're going to have all of the bacteria from the lower urinary tract that is going to be in that sample if we do not take it directly from the bladder. So taking it directly from the bladder is going to give us the most sterile urine sample that we can get. So that may be another reason that we need a straight cath. The other kind of catheter that we have is called an indwelling, or a Foley catheter, F-O-L-E-Y, indwelling or Foley. And that is just like what it sounds. We're going to put it in, and it's going to stay in, at least for a certain period of time, okay? Usually we have to change out, if we have somebody with an indwelling or Foley catheter, those have to be changed typically about every 4 to 7 days, depending on what they have it in there for. So we don't want to leave it in there too long, because then they have the potential of getting a bladder infection as a result of it, because it's been in there too long, right? So those kinds are indwelling. They do stay, but we do have to change them periodically, okay, to make sure we maintain the sterility. So once I've came in, I've identified myself, I've identified my patient, they understand what we're going to do. I'm also going to tell them it's not a painful procedure. It's uncomfortable, and you kind of feel pressure, maybe just a little bit of stinging, but it's not a painful procedure, okay? So it's just kind of uncomfortable. How many of you have ever had a catheter before? Anybody?
When you give birth, don't they go on?
Not always. Not always. Occasionally. Okay. So, if you've known anybody that has it, you'll hear them say that it is just, it's kind of pressure. All right. So I want to show you a couple different kinds that we're looking at here. So we talked about the straight catheter, which is one that does not stay in. We put it in, we drain the bladder, we take it out. I'm going to pass this around. This is a packet, okay, that contains the items that we need to do a straight catheterization. So we'll pass those around. You can also just simply use the actual urinary catheter, drain it directly into a cup or a basin, and that is what this is. Now, these are measured in sizes, and they're called, the size is called a French number, French. So this one is both of them are actually, is a 14 French, and that's just telling you the different size that they have. So it's not measuring, hey, this is a size 14 and this is size 16. All right, it's a French 14 or a French 16 or whatever it is that you're using. So I will pass those around. Again, these particular kinds are only used as a straight catheter, not one that is going to remain in place. This one is an intermittent catheter, so if you have people that have to catheterize themselves, or we can actually use these in the hospital as a straight catheter, okay? We put it in, we drain bladder, we take it out. All right, so here's another sample of those. We'll pass that around. And then this one here, this one is actually a 24 French, so this is a large one. Now, would you think that on a male, we would be using a larger French or a smaller?
Smaller. Doesn't for a male, it goes inside their.
They have a larger urinary opening than we women do. So men actually are going to have a larger one. Okay? So it kind of sounds backwards, I know. So I'm going to send this around. This is just another example of a kind that we could use. Okay, and again, this is a 24 French, right? And you'll see the size right up there.
So is it kind of like an enema?
I'm sorry?
So is it kind of like an enema?
Does it what?
So is it kind of like an enema?
Enema?
Yeah. So you know when you drain it?
Instilling something.
Yeah.
With this one, we're removing it. Okay? Now, I do have a kit here. This is a straight cath kit. So this has everything in it that you would need to straight cath somebody. Again, straight cath meaning we put it in, we take it out. Okay, so that is a sample of those. The one that I'm going to be using is a Foley kit. So I'm going to have this here. Again, I've already talked to my patient. I've identified them. I've identified myself. They understand the procedure. They know there's going to be some pressure with it. Yes?
I have a question. So would this be the size you would use in the male?
Do it.
Is this the size you use on the male?
It is.
Oh.
Yeah.
Dude,
Okay.
This is,
So once we've done that, we need to get the patient in a good position for us. Now, I obviously need to have the rail down that's closest to me. Typically, you're going to do this on which side of the patient that you're dominant. I'm right dominant, so it is going to be best for me to stand on the right side, and you'll understand why here in a few minutes. It all has to do with how you hold and everything. But the other rail I would want up, but I'm just going to leave it down so you guys can see a bit better. Okay? The next thing we want to do, we want to get them to an appropriate height for us so we're not sitting here bending over them and breaking our back. All right? So we're going to get them up to an appropriate height. And that's pretty good right there. Right about your waist level should be pretty appropriate. I'm going to go ahead and use the hand sanitizer. And again, I've already identified them. I've identified me. They know what's about to happen. Now, it's very important while we're doing this that we maintain as much privacy as we can. And this person doesn't even have a sheet, so that's going to be really difficult. But we shall do our best. You don't see a sheet laying around, do you? Okay. So typically, I would have the sheet pulled up here, close to my working area. Okay. I can also have the gown up here to cover up the upper portion. All right. But I would only expose what I absolutely have to have exposed. All right. So I'm not going to do the exposing yet. So I'm going to go ahead and get this in position. I would tell them for the female, they're pretty much going to sit like frog-legged. So they're going to bend their legs up and they're going to let their knees fall to the side. Now, I'm not so sure this person is able to do that, but nope. Okay, so just know knees bent up, legs bent up, knees fall to the side, and that'll give you a little bit more of a workspace. Now, typically when you're doing this on people, especially in the office, they are coherent, okay? So they can kind of help you out. Most people are going to be ambulatory, meaning they're able to move on their own, all right? So when we do certain parts of this, I have to have the patient move into a different position. So for this part, I'm just going to go ahead and open it up. I would set it up here close to where I'm going to be working. I'm opening this up. Now this kit is sterile. Okay, first thing I'm going to do you think that this catheter needs to stay sterile?
No, because it's going into the...
Yeah, I mean it does, especially the part that's going to be inserted inside the urethra. So at this point, I'm going to go ahead and I'm going to put my regular gloves on.
I have a question. Is this more common in hospitals or like little family clinics?
We definitely do it more frequently in the hospital, but according to what kind of office you're working in is according to how frequently you're going to see an office. If you're working in a urology office, you're probably going to see this a fair amount. Yeah. Family doctor, not so much. Yeah. All right, so I'm going to very carefully pick up this portion that does not have to be sterile. I'm going to scoop this over here to the end. And I'm going to set this out here on inside my sterile field, okay? Once I have that, I need to go ahead and get these drapes out. Okay, this drape is just going to go under them, okay? Actually off to the side here because that's where I'm going to set my stuff on here. This next one, and again, I'm just picking it up from the very corner. Okay, this is the absorbent towel that's going to go under them because inevitably, at least when you're pulling the catheter out, you're going to have some drainage. Now, the way that I put this under them, now I would be asking them to help to lift up their hips for me, and I would slide this under. The way that we do this, we hold our hands facing us and hold the tab between our thumb and our finger, and we fold under. Then we're going to scoot it under their bottom and let it go. Okay? So one more time, we're going to hold it like this between our thumb and our index finger, fold it over. Can you help me lift them up? They would lift up their hips. I know, he's heavy. Lift up their hips. Okay, go ahead. Just enough to get them under, okay? But again, we fold it under, slide it, and let it go. All right? So now we're ready to go ahead and start setting up the rest of our sterile field. To do that, I need to have on my sterile gloves. However, keep in mind, and you guys know how to put on the sterile gloves now, keep in mind that one hand will remain sterile the whole time while the other one will be considered dirty. Okay, and you'll understand why here in just a minute. So I've got my sterile field set up here. Now I need to go ahead and get the rest of my items out here. But before I do that, I need to go ahead and put on my sterile gloves. Okay, so now I'm going to go ahead and take these off. Before I do that, if I can get it without touching anything inside, do you think this needs to stay sterile?
No.
No. The inside, yes, not the outside. So I'm going to set it out here and have it ready to go. Do you think that my transport bag needs to stay sterile? No. So I'm going to set it out there and have that ready to go. Now, the rest of the stuff that's in here needs to stay sterile. So I'm going to go ahead and take that off. I'm going to go ahead and put on my sterile gloves. And again, you guys know how to do this. We did it last week. I'm going to pull this up and just tell them, make sure that my curtain's pulled for privacy, okay? I'm going to expose that perineal area. Now I'm going to go ahead and put these on. Okay, now I can touch whatever I need to touch. This is actually a fenestrated drape. Does anybody remember what fenestrated means? It has a hole in the middle, and that's what we're going to expose the area we're going to be working with. Okay, then we have some lubricating gel. So I'm going to open this up, and I'm going to squeeze it out here. I actually have another one, and I'm going to do the same thing. Because when we go to put this inside their urethra, if it is not lubricated well, it ain't gonna go well, all right? Number one, it's gonna hurt like the dickens. Number two, you're gonna be trying to slide this in something dry and it does not work very well. So we have to lubricate it up. So once I have those squirted in there, I'm gonna put those to the side and I'm gonna lay this in there so it can just be kind of bathing in the lubricant, all right? The next thing I'm gonna do, you have two different options here. This is povidone iodine. You have ones that are on like a large cotton swab, and then you have some that's just the liquid that's contained in it. I'm going to pour this out. If it's just these, I'm going to pour it out onto the top of these cotton balls, okay? I'll pour it on top of these cotton balls. If I have these, I don't have to use the cotton balls. I can just open it up and take each swab out, okay? And it has the iodine on it. So according to which one you use, if I'm using the cotton balls, I will need to have a pair of forceps to be able to pick up each of the cotton balls to do the cleaning with. Once I have this all assembled, now, still get sterile gloves on the itch. Now what I'm going to do, my left hand, I am right dominant, okay? My non-dominant hand is now going to take and separate the labia. Trust me, on a real person, it's way easier. This is hard rubber, okay? I'm going to separate the labia so that I can see the urethra. And again, this is kind of hard material to hold separated, but we'll get it done. All right, now it's important to remember, on ladies, we have multiple orifices down there, okay? We have one little area that kind of looks like a hole, but not really, and that is the clitoris. We have the urethra that is underneath that. Below that, we have the vaginal opening, and below that, we have the rectal opening, okay? Make sure you know your holes, all right? It has not been an uncommon thing to accidentally or inadvertently get the catheter inside the vagina. It happens. If it does, start the whole procedure over. Okay, so I'm going to try to hold this open. The first thing that I need to do is to clean it. Now, if this is the perineal area, okay, and we've got the clitoris here and the labia off to the side, I'm going to take either the cotton swab or I'm going to take one of these. I'm going to wipe from the top here, okay, on the side. I'm going to wipe down this side, okay? So if this were the opening here, I'm going to wipe from the top, this part here, down to the vagina. Get rid of that one. I'm going to take the next one. I'm going to wipe down the other side from front to back. Get rid of that one. Then I'm going to take the last one and I'm going to go straight down the middle of the opening to where it's going to go across the urethra. So I'm going to take that and swipe straight down the middle. Again, front to back. Always, always front to back. Once I have done that, I'm going to take my catheter. Okay, remembering that this part must stay sterile. Okay, this is the part that's going to be inside. This part must stay sterile. I'm going to hold it up here close to the tip. Does everybody see that little opening there?
Yeah.
Can you see that?
Mm-hmm.
Okay. So that little opening, there's a point to it. That's how the urine gets in. Okay. So this has to stay sterile. Remember, my right hand is sterile. My left hand is dirty because my left hand is holding. Again, I'm going to put it and get lots and lots of that lubricant on it. Once I have that lubricant there, first I'm going to make sure this is closed. So you have an open and a close on here. You want to make sure this is closed. Because if you don't, as soon as you put that inside the bladder, you're going to have a mess all over the bed. All right? So make sure that this is closed, and that is. Now I'm going to pick that up. Again, get it all lubricated up. I'm going to try to hold this open. Okay, and we're going to insert it into the urethra. Oh, I'm going to actually have to put lubricant on it. That ain't moving. Okay. All right, so we're going to hold that apart can as best you can. And we're going to insert it. You're going to feel a little bit of resistance, and then you'll feel it kind of give, okay? So I'm just feeding this in, Yeah, I don't think you filled it enough because it should be all the way in now. Okay, so once that is in, I'm then going to use my non-sterile hand. Now, automatically you would see urine coming in this, okay? But, again, I don't think it was filled enough. While I'm holding this, I am now going to take my syringe, okay? My syringe that has 10 cc's of normal saline in it. And I am going to attach it to this end, this orange end. Once I attach it, I'm going to squeeze all of that in. Who knows what it's doing?
Pushing.
It's creating a balloon, and I'll show you what it looks like when I take it back out. Okay? Once I have all that in, I can take it out. Then you can give a little light tug, and you'll see that it does not come out. Okay? Because we have the balloon in there. Right? And that's what the purpose of it is to keep it there without it coming back out. Right? Once we've done that, we're going to go ahead and take whatever gauze we have left and clean them up. Then we can go ahead and take a leg strap. Okay, this is a leg strap. Looks just like that. And we're going to put this on the leg. And it's just peeling these off, okay? Just peeling off the backs of the sticker, putting it on the inside of the leg, and attaching this to it. So that when they move and stuff and turn over, it doesn't automatically try to yank it out, okay? Then I can go ahead and take a sample from this, because remember, this is all sterile. So as the urine came out of this, I could go ahead and take the lid off of my cup, open this up, get my sample, go ahead and close it back. And now this is going to be good to go. Then I'm going to go ahead, like I said, finish cleaning them up. Tell them to make sure that they understand that they no longer have to go to the bathroom, that this is going to urinate for them. Make sure they're comfortable, put the bed back up, put both rails up. Right? If they're on the exam table, help them down. Okay, but clean them up real good first. All right? Now, if we were doing a straight cath, and I'm just going to show you one thing real quick. Let's go ahead and take this back out. If we were removing it, first thing we do, take out the fluid that's made that little balloon in there, okay? And then we would want to have some type of absorbent pad. I didn't show you guys this one because it was too hard to go through it, but this is the fenestrated drape here that we can put on there to separate it and everything. But like I said, this anatomy is a little bit more firm than we're used to using here. Then we're going to go ahead and slide it out. Make sure you have that absorbent pad under there because it's going to pull some urine with it. Go ahead and slide it out. Okay, and that's all there is to it. Remove it, clean them up. Now, I want to show you what it looks like when we inflate the balloon. Okay, so that's a full balloon. So that's going to keep it from coming out inadvertently. Now, I will tell you, when I worked in a nursing home and in the hospital, when I would have some people that weren't very lucid, so they didn't have all their faculties about them, they pulled it out with the balloon in place. Can you say ow? All right. Yeah, so not ideal, not something you want to do. You want to talk about pain? Yes, that one will cause you pain. All right, so that's all there is to doing this. Can you give me a paper towel?
Do they feel whenever we blow up the balloon or?
Oh, yeah. They can. When you give it that first little tug, they'll feel that, yeah. But, not usually after that. Now, the only other thing I want to show you is that when you're doing a straight catheter, when you're doing a straight catheter, what you're going to do is, so once I have inserted it in, I'm just going to show you really quick. You won't have all this stuff with you. It may come with a little tray. Open end, nothing there. When you put it in, that end had better be in some type of receptacle or you're going to have a very big mess on your hands, okay? So that's the only difference is when you're putting these in, you have to make sure that this stays inside some type of receptacle, all right? Because when you put it in, it's immediately going to start flowing out. Now, if I were doing this as a straight cath to get a sample, I would get that pretty much in place, have my cup sitting here, and then hold it over the cup, get the sample, and then I can let the rest of it flow out into my little pan, okay? But there's no inserting the fluid to make a balloon, okay? This is not an indwelling. This is just a straight cath. As soon as we're finished, we take it right back out, clean them up.
I have a question.
Okay? Yes.
So, look, I thought I was gonna.
You can go ahead and stop the video. Thank you.